Good evening. It's Wednesday, July 1st, 6:35 p.m. Worldometers has reset it. It's time to report. So already the first day of July already is worse than any day that we saw in June. The U.S. has broken daily cases over 50,000 cases today. That is a grim milestone for the USA. Look at deaths. Brazil has been top deaths for a long time now. Now keep in mind, people are saying that, oh, it's just, they look at these like they're just numbers. These are not numbers. These are people, and people are not numbers. Each person that's dead was a life that was precious to somebody, because every single life is precious. So for people to look at this and say, "Oh, well, it's only 183," like, no. It's like everybody now knows somebody infected or who's dead, who's been killed by the virus. I don't like that attitude that people have, and they also almost broke 200K in a day. You see, we're at 196,000. Some countries didn't report. So if they get their testing together, it's another milestone. Over 200,000 infected in one day, which is going to happen pretty soon in July. Let's go to USA state by state. Now, Texas was the worst state today in terms of new cases. They reported 8,000 new cases. Florida at 6,000. California, where I'm at, 6,000. LA County, I think another 2,000. Arizona, almost 5,000. Now, all these numbers, I remember back when they used to be a lot smaller. But we got to keep in mind, though, the top states, their hospitals are collapsing. Their ICUs are past capacity. They're turning patients away. There's no beds. They are literally kicking out patients from mental hospitals to conserve space for the COVID patients. Arizona, top one in deaths. Not surprising. California. Now, keep in mind, California is the most heavily populated state in the United States. We saw the carnage in New York when they only have a population of 9 million. California has a population of 40 million. So if it kicks off in California, it'll be unprecedented. Now, also keep in mind, because people don't really look at this, and it's also important to look at, it is the zone on the bottom: Veteran Affairs, U.S. Military, Navajo Nation, federal prisons. The U.S. military has 18,000 cases and they got Veterans Affairs, Navajo Nation, federal prisons, 7,000. So these are also important to look at. And then one thing interesting about Warometers, I don't know if I mentioned it on here yet. If we remember back in February when we had the whole incident with the Diamond Princess, that boat cruise ship that was stranded in the sea for a long time, and it was all the rage a while back. Let's see. Nobody talks about it anymore. There were a lot of studies done on that incident, like how they found out that the virus could survive on the ship's surfaces for up to, I think it was 17 days and still be infectious. So Diamond Princess from February still shows 48 active cases and 4 critical. I think it's been there for a couple of months now. I don't think they've been updating it anymore. In fact, there's no sources anymore. No more data. I think it became part of a media blackout. There's no link to go to the Diamond Princess compared to the other countries. I'm not saying about the country, but you get what I'm trying to say. You can't go any deeper than just these face value numbers. And so what happened here? What's going on? Why did everybody stop talking about it? Now on to today's news. Let's dive right in. Let's get straight to the point. The governor of California has announced more measures to combat the surge in coronavirus after another record-breaking day of cases in America's most populous state. That's important to, like I said before, California is the most populous state. Gavin Newsom confirmed that indoor activities at restaurants, wineries, cinemas, family entertainment centers, zoos, and museums will be banned for the next 3 weeks. I can imagine the outcry from the nothing burgers, the pandemic zombies. Bars were ordered to close both indoor and outdoor operations. I saw a picture of people protesting. I think it was they were like saying bar lives matter. People who are like, I mean, basically a bunch of alcoholics that are desperate to get back to bars who can't handle being at home all day. I don't blame them for that, but they don't seem to understand. It's the same crowd that denies masks, that calls themselves being muzzled by masks. Thought that was ridiculous. Many of California's beaches will be closed for the Independence Day weekend, but Mr. Newsom says he is concerned that people will still be gathering for what is traditionally America's biggest party weekend. So 4th of July, I think, unfortunately, like Memorial Day weekend will become a super spreader event. People are not going to listen. They're going to want to party, and then they're going to cry and say, oh, I got infected, don't be like me. Well, you get no pity. Pennsylvanians are now required to wear masks whenever they leave their homes, rather than simply when they enter businesses under a new order issued by the Wolf administration. So good. Again, all these Asian countries, partly why they're not in the top ranks and why Latin America and Europe and Africa are hitting such harsh numbers is because Asian countries wear masks because they've had outbreaks before. They had SARS. You know, they know that. Like, I've always seen Asians wear masks my whole life. And I always thought about it, and it wasn't until the pandemic happened that I learned that it was because they've seen these kind of things before, and they know the seriousness of the masks, but not your average American. Official U.S. coronavirus death toll is a substantial undercount of actual tally, Yale Studies finds. The 781,000 total deaths in the U.S. in the 3 months through May 30th were nearly 19% higher than what would normally be expected, the study said. Now, this is very interesting because it has to do with excess deaths. We have an average of deaths that are reported every single year, but this year we have a lot of deaths than expected. And people think that these are the deaths. A lot of these excess deaths are actual COVID deaths that are deliberately not being reported, or just they were not tested. And they were labeled as some other kind of deaths. Let's see. The 781,000 total deaths in the United States in the 3 months through May 30th were about 122,300, or nearly 19% higher than what would normally be expected. Now, I mean, granted, yeah, because of the pandemic, people are dying for certain reasons, but if everybody's at home, they're also not at risk of getting killed outside, like in a car crash, etc. So that's also something to look at. According to the researchers, of the 122,300 excess deaths, 95,235 were attributed to COVID-19. They said most of the rest of the excess deaths, researchers said, were likely related to or directly caused by the coronavirus. Now, I've heard a lot of stories of people dying and being immediately cremated and not tested. So I think that is also part of what made a lot of the excess deaths, especially in areas like Mexico and Brazil and China, where the crematories were just running in a fury 24/7. How many of them were tested? You know, it's a huge cover-up. The researchers noted the gap between the reported coronavirus deaths and the excess deaths varied by states. For example, California reported 4,046 COVID-19 deaths and 6,800 excess deaths, leaving 41% of the excess deaths unattributed to COVID-19, they said. What went on with those deaths? How many were tested? What did they die from? We will never know. We will never know. And that's just one state out of the whole entire world. Texas and Arizona had wider gaps with roughly 55% and 53% respectively of excess deaths unattributed to COVID-19. Wow, the other states are getting hit hard. Who would have thought? So yeah, excess deaths are definitely something to look at. Ecuador was one of the highest offenders. I think they had like an excess of 10,000 deaths that just kind of like happened this year that was not expected compared to the yearly deaths that have been reported in the past. Groom dies after infecting over 100 wedding guests in coronavirus in India. Family ignored his wishes to postpone the nuptials amid his spiking fever. The 30-year-old software engineer developed diarrhea and a high fever before his June 15th wedding, but his family forced him to swallow a painkiller and go through with the ceremony, which was attended by more than 360 people in Palinganj. 2 days later, his condition took a turn for the worse and he died on the way to the hospital. All of the deceased man's close relatives were tested for the illness on June 19th and 15th, and 15 were confirmed to be infected. Even though he was feeling unwell by June 14th and wanted the wedding deferred, family heads from both sides advised against it, citing huge financial losses if the arrangements had to be canceled. And we will keep seeing stories like this. Yeah, I've seen a lot of really bad super spreading events in India, and this is just one of many. An elderly couple in Texas reportedly died last week, only 50 minutes apart from one another, while holding hands at a Fort Worth hospital, as each of them succumbed to complications from the novel coronavirus. Curtis Tarpley, 79, and his wife Betty, 80, passed away at the Texas Health Harris Methodist Hospital. According to the Fort Worth Star-Telegram, they've been married for 53 years and had 2 children, Tim and Tricia. Their bodies will be donated to the University of North Texas Health Science Center to be studied. A tragic story. Fed warns stock market of a second recession if the coronavirus pandemic isn't brought under control. Now, I would say, what do they mean by this? Because the stock market should have right now crashed apocalyptically, beyond repair. But what happened? The Fed has the ability to create money out of nowhere. That's why there's that meme that, say that the printer goes brrr. Because the Fed can just bail out, as much as they need to make it look like the stock market is still doing good when it's actually doing really, really bad. And we've seen abnormal, unusual growth in the stock market as a result of the Fed just printing money like crazy, or like wild. And the thing about it is that they are bailing out the billionaires. If you really look into it, they don't want to send any more stimulus checks, but they're willing to put in billions to save the stocks of billionaires. That's what the Fed is doing. So, right now, just the market is just a disaster. But the printer goes brr, and everything's solved. Lake Elsinore man says he regrets attending party, then dies of coronavirus. Tommy Macias went to a party with friends a few weeks ago. Then he got a phone call from one of those friends saying he tested positive for COVID-19 and everyone should get tested. Just days later, Macias died in the hospital. It was just one moment for him because things were becoming so much more lenient. He hadn't seen his friends for so long. He thought things were getting better and he decided to go see them, and so quickly he was taken from us, she said. Macias started feeling sick and thought it was issues with his diabetes, but last Sunday he had breathing trouble and was rushed to the hospital. He was intubated and put on a ventilator, but died 2 hours later. We wish we could have told him how much we loved him and to be able to say goodbye, Lopez said. So we have a guy that basically quarantined himself this entire time since the beginning, missed his friends, decided to take one little silly risk to go to a party, and ends up catching it and dies. Like I said before, people can catch this making the smallest mistakes. That's why there's thousands of people that don't know how they got the virus. I mean, it's also probably because they don't do the research. They don't realize how contagious this virus is. This virus is most likely something that came out of a lab. And if you see the type of protective gear that those scientists wear, think about it. Doctors with all their PPE are still getting the virus. You need virologist tier PPE to really be safe from this. So you can only imagine how contagious this thing could be, and it's still not understood how contagious it is. There are reports that the media is overly underreporting how contagious this virus actually is, and the mutation, the D614G, they fear it's much more contagious than what's been commonly reported. Oakland Zoo reportedly facing permanent closure if it can't reopen soon. Now, there are businesses that I never thought would get shut down, and the zoos was one of them. And the fact that zoos are near financial disaster and permanent closure, that's worrisome. of what happened to other kinds of businesses that we just take for granted and just don't ever assume that they'll ever go bankrupt and shut down. Young adults unconcerned by coronavirus may be killing other people, doctor warns. I'm not too scared of getting sick, said Clarisi from San Francisco. I just personally don't care, said a young person in Boston. I haven't gotten sick yet, said another youth. The problem is that while you may not die and you may not even know you're sick, you may be killing other people. If my parents were to get sick, I would not be able to live with myself, said one woman. While young people are less likely to be hospitalized or die of COVID-19, last week, 2 17-year-olds died from the virus in Florida. Researchers debate infecting people on purpose to test coronavirus vaccines. Now, keep in mind, this is a virus that there's no vaccine to. So you would have to be pretty brave to be willing to be perfectly healthy and get infected and see if these vaccines will work on you. So no matter how you look at it, these people are being turned into guinea pigs. And the debate is whether that's moral or not. It's not. You know, there should be better ways, but people are desperate. And so that's this is today's news. We're seeing like everybody's been reporting. Right now, we're seeing mostly cases among the youth. That's why deaths have gone down. Alongside that, people are able to find better treatments. Now, what's going to happen in July? Since we're seeing mostly young people get infected, they're going to end up infecting their parents, uncles, aunts, grandparents, and we're going to have a disastrous second wave of deaths at this point. Too many young people getting infected. They're going to pass it on to their families. And I ask you one thing before I leave. Was it really worth it because you wanted that margarita? Was it really worth it?